You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Hot topic. Now, we've had Dr. Keller on the show before. All new photos today, and he's going to help us understand how you can have a natural-looking facelift. And according to Dr. Keller, even your friends won't know that you had anything done. With us, we have an expert on the topic, Dr. Keller. Welcome to the program.
Thanks, Randy. It's good to be back.
Now, for people that don't know you, okay, professor at UCLA, you teach the facial plastic surgeons. Why don't you tell us a little bit about your background, training?
Yeah, basically, I have a private practice both in Santa Barbara and at UCLA. And my job there is to train the facial plastic surgery fellows in aesthetic surgery. And basically, that's a really rewarding topic. It's probably one of the most rewarding things I do is to train young minds. These people have already finished a residency. They're going into academics, and they're just brilliant people. And so it's really rewarding to contribute to their training. There are other people on the faculty as well. But, one of them even did the first face transplant at
Is that right?
Clinic. Yeah, it was pretty amazing.
One of the guys that trained with you, under
Yes,
you?
yeah. And, so it's fascinating to take these young minds and mold them. The first complete face transplant, anyway. So it's a great job. It's a great life.
Now, and because I think people in Santa Barbara, my show's been airing in Santa Barbara, airs all over the United States and Canada. We just got syndicated. But I think people take it for granted that in Santa Barbara, and I always say I'm not endorsing the doctor of the show, but I am endorsing you on this particular show because I know you do great work. But people travel from all over the world, from Dubai, to see you. Is that right? Is that still the case? People go to you when they want a natural-looking facelift.
Well, Santa Barbara's a pretty small town. It's not a small town. It's a very sophisticated, wonderful city, and I wouldn't live anywhere else. So about a third of my practice is from Santa Barbara, a third of it's regionally, and a third of it's from all over the world. And that's been true for quite a number of years.
And you do doctors, other doctors, facelifts, and celebrities, local celebrities, men. Are more and more men doing this, by the way?
Today, my practice is almost a third men, but it's a little different. Men want different things than women. Obviously, a guy doesn't necessarily want to look beautiful.
Okay, yeah.
He wants to look with it, competitive, youthful. And so it's a little different type of orientation to the whole thing.
Okay, now, one of the new things, I said, I invited you to come down on the program today, and you got on your plane, flew over here, so thanks again. But I said, what's new? Bring something new. And you have a new ebook. You show this ebook to patients, they go online, but it's filled with before and afters. It's really nice. Tell me about the ebook.
Well, the ebook, we sort of wanted people to understand why we did what we did. So we wanted to create, and I know this sounds odd, but sort of a comic book with pictures and illustrations, and yet an explanation of why. And we're working on it. It's always a work in progress. But I think it represents our own particular approach to what it is we do and why we do it, and the different areas that we work on, to achieve those results. Because what we want to get is a natural look that people don't notice. They just think you look great, and yet you see the before and afters, and there's really a difference.
Now, there's somebody at your office. I think she's an RN, esthetician. I visited your office. I feel like I know her a little bit, right? I don't know if we could mention her name, but you did a facelift on her. I just found out. I thought she was about 42 max, right?
Yeah, that's Maria.
Yeah.
And that's what, we've talked about it in the past. But
because when I think of a facelift, respectfully, I think of a pulled back look.
That's not everybody's fear. Some people would like a pulled back look, and they're desirous of that. There are people that are very happy with that. That's not our goal, because what we want to do is put all the structures of the face back to where they used to be. Now, you're not, there's volume loss and other things that are going on, so you're not going to achieve an 18-year-old look. Mm-hmm. But on the other hand, you can really, women age all of a sudden. They don't age in linear fashion.
So during menopause, they age faster, you're saying?
Women age all of a sudden around the time of menopause.
Okay.
And it happens, a woman can lose 30% of her collagen in her skin and ligament area in 3 months, which is different than a guy. Guys' andropause progresses more linearly.
Okay.
So women can say, I listen to women every day, and they tell me all of a sudden I became invisible. All of a sudden things changed. And, that's important to realize.
Invisible meaning, people aren't looking at them like they used to.
Not only looking at them, but people don't notice them as much.
Interesting.
Because a lot of women have been very attractive for their whole lives, or, attractive, because most women are attractive, obviously.
Yeah.
But all of a sudden things change. And it's very disruptive because
And they took for granted when it was happening.
Yeah.
I think you told me that.
I did.
And now all of a sudden they're going, wait a minute.
Yeah.
What's happened?
Nobody's holding the doors. Nobody's stopping to let them walk across the street,
that right?
type of thing. Yeah. And, we like to think of ourselves as very deep, but really appearance-wise, we are a little shallow in society nowadays. We do take notice, people who look better, get better jobs and are paid more and so forth and so on. And that's not necessarily you have to be glamorous or drop-dead gorgeous.
Just don't want to look exhausted.
Exactly.
Right.
Tired, mad, sad,
Yeah.
whatever. So I think it's our job to make you like the way you look. It's like the Men's Warehouse commercial. You're going to like the way you look. and that's the whole thing, because a lot of it's attitude, no question.
So is that your goal? I mean, when you look at the face, you see the end result, you're thinking they're going to like the way they look.
Well, I'd like to think so.
Yeah.
And, I tease women that I have the hardest job in the world, and that's to make women happy. But actually, that's not true. I think we have a pretty good formula and pretty good consistency with it.
Now, you're a busy guy, and I mean, you do more facelifts in a month than most guys do in a year. I mean, you do probably, up to 3, maybe more a week sometimes. How important is that to go to a surgeon that's doing a lot of the procedure? I mean, it seems like an obvious one.
Well, I'm sort of a one-trick pony in that respect. But I think it's important.
Meaning you only do facial work.
I only do facial work, facial and noses and eyes and things like that. So that really limits me as to what I do. I ask other people to do everything. I'm not a general plastic surgeon. I'm a facial plastic surgeon. And I think that that's good. That's not to say that facial plastic surgeons are the only ones that do a lot of facelifts, because general plastic surgeons sometimes specialize in it, and it just depends. But I think it's important for a surgeon to be active in the field, that he's doing, obviously. Mm-hmm. Cardiac surgeons who do a lot of surgery are generally, not always, but generally better than people who haven't done that much.
So your new ebook, and by the way, very impressive. Look, I mean, I meet a lot of medical doctors all over the country, and you're putting your work right out there with picture after picture after picture. I mean, people could pretty much find somebody that almost looks like them, and they could say, yeah, that's me.
Well, yeah, we've actually had to cut, we keep making it bigger and bigger. I hope that people, can go through it. But I think it's a good idea.
So who do you want? I mean, you want potential patients, women, men, that are considering, they don't like the way they're aging, to go online and to learn about their options. Is that right? I mean, tell me why.
I think that it's important because I think you want to match your concept of how people should look with their concept. And communication is a big part of what we do today. And facelifting is no exception.
Okay. So this is it. This is like page 5 of your book.
Well, if you look at this woman, you can see the jowl there and how that's formed, and how the cheek has fallen, and how the neck is much bigger. And we call that gravitational descent. Things have fallen. She doesn't feel good about the way she looks. And that happens relatively quickly. In this case, the woman's 60s. So when I evaluate her face, here's what we do. We want to lift the jowl and the muscle and the skin all in one layer so that it doesn't look creased, or we don't get these swoop lines that you frequently see. We want to lift that middle part of the face and pick that cheek up, because the ligaments that used to hold it up have fallen now.
So are you going for 10 years with her, 15 years? I mean, in your mind, you say, I could probably get a really good result with this woman.
I want her to be happy with the way she looks. And if you look at her, she brought her driver's license picture in from 12 years ago. And I think that the post-op picture that you see is pretty much how she used to look in that driver's license picture.
That's 15 years, probably?
Because women age all of a sudden, bang, and it really bothers
The side view there is pretty good.
Yeah, it's just a little bit of a lot of things rather than a lot of
like
any
what?
one thing.
So
We're
what'd you
not
do?
pulling things straight back. We're picking up the structure of the cheek and reattaching it to the bone. We're picking up the skin and muscle and shifting it upwards. And the neck, we're doing many different things, but in her case, we made a little incision, brought the muscles together, split them and pulled it back. So, you know, you need a lot of tricks to do a good job
What
on
if-
everybody.
And maybe you probably can't talk about what she specifically said, but what did they say? When it's all done, they're healed up, it's relaxed, what do they tell you? Or maybe their friends tell them, or family, or a loved one, or spouse, or partner.
A lot of people, believe it or not, even seeing these pictures, don't even notice. Because in people's minds, they've always looked like that, particularly when you see them straight on.
Do the patients say you've changed my life, ever?
Oh, yeah, that happens a lot, actually. And it's about the way they feel about the way they look again. Not, I think we do a lot for the way they look, but it's the way they feel about the way they look that really makes a
Now,
difference.
by the way, I think anybody looking at this at home, and I'm really trying not to be on your side, one-sided here on this, but that could look like the daughter of that woman. I mean, her before picture looks like,
Yeah, this is sort of an extreme example because this woman didn't do anything until either late in her 60s or 70s. So we're going to be making a big difference.
here's my question, because a lot of plastic surgeons, and I'm skeptical as it is anyway, right? And we've even talked, there's a few things I don't even believe what some of the things you're saying when you say how women want to look pulled and tight. I find that hard to believe, right? But when plastic surgeons tell me I just can't get photos, they don't want to give me their photos, I always think maybe because they don't have any good ones to show me. Because you have a lot of photos.
We do.
What is it?
We've been very fortunate, and I think that that's the relationship that we have with the patient, because surgery isn't the whole thing. This is an emotional experience for women going through. A woman, it's maybe a 2 to 3 on the pain scale, which isn't horrible because a lot of women do childbirth, which is a 10. Okay, but for a lot of these women, it's a difficult passage to get through. It's a passage that they need to go, and they need to be ready for it and have a lot of support. So our office provides a lot of support. The women in my
Okay.
office are naturally caring. They take care of people. You can't make people like that. So you have to have a team that gets people through, both in the operating room, a team there, but a team in the post-op recovery period as well.
Now, something you said, and I was doubting you as you said it, where you said, you want to, people get better jobs with the way they look and things like that. But in this case, I mean, when you look at that woman, if you were going to hire those two women, one looks absolutely rested and youthful, and one looks tired.
Yeah, as we say, you look tired, mad, sad, even though you don't feel like.
So you have more photos. What else do you have?
Well, Randy, we have this lady right here.
Okay.
And if you look at her, she's about 49 only, but she looks mad and sad and tired. And people are saying, "Why are you so mad at me?" type of thing.
Okay.
And basically, she wasn't going to let us use her pictures, but she walked into Trader Joe's and somebody carded her, an 18-year-old granite that didn't know the difference.
Yeah,
But
yeah.
she was pretty happy about that. And you can see the lines between her brows are better, the cheeks lifted up, she just looks happier.
Yeah, I mean, well, she looks rested for sure. I mean, she looks like just a younger, better person. Now, did you do a combination of laser work, a little bit of fillers, or is this just
No, this is just
like
lifting.
like a mid facelift kind of a thing?
No, this is a facelift with a mid facelift
Interesting.
and a brow.
And okay, so going to your next one. Very good stuff.
Yeah, if we look at this woman, you can see that she just has a little bit under her chin.
Yeah.
And she's a model, so that makes a difference in the pictures she takes. So here we did use a laser, or we'd use Thermi today, to take that down and tighten the skin just a little bit. On page 16 here, you can see that that's Vanessa, who works in my office. She's my patient care coordinator.
Wow.
And this was 4 years ago, and she really felt better. You can see that there's a difference here. We put a little chin implant in. We lifted the neck a little bit. And you can see it really made a great difference to the point where she decided that she really liked to look good and lost some weight and everything else. This doesn't show the weight loss, but you can see the
Well,
difference.
that before, and I've met Vanessa, and she's a young woman.
She is. She
I
is.
mean, she's
30s.
30s. Interesting. Big difference. Big change.
In a younger woman, what we may do is actually suture right through the skin to lift up the neck. And that's a technique that can work well. It's not for everybody. But that's my point, is that you have to look at what's going on with people. You can't say, oh, I do a neck lift this way. On page 19, you can see a woman here who has a different type of thing. It's a digastric muscle that's sagged. And we used to have to open up the neck and take a lot of it out. It's a muscle that helps to open the mouth, but it can become really big and produce a little lump. But with that web to pick it up and move it upwards, you can see that this is done very well for her.
How long would that last?
Long periods of time.
5 years, 10 years?
Well, she's 5 years out now, I think,
Okay.
4 or 5 years.
Well, see, you go from looking a little bit sloppy or a little bit overweight to looking lean and fantastic.
Yeah, and
That's very nice.
There's no weight loss here either. And that's a very common thing to say is that, gee, you lost a little weight. The woman on the left and the woman on the right have muscle bands. And these are muscles, basically our neck has skin and muscle that's right underneath it. And there are layers of fat sometimes in between. But when we have these little muscle bands like I have right here, you can see that the ligaments of the neck that hold up the muscle relax and everything falls downward, and we see these two little
Is it mostly
bands.
the lean? Because I see this, by the way, but it seems like thinner women, I see it on these bands. Thinner women. But it could be anyone.
That's true. And as a matter of fact, if someone just liposuctions a heavy neck, that can uncover those bands because those bands are covered with fat.
Oh, I see. Okay.
Yeah.
Okay. So with this woman, you just did. And by the way, what's the downtime on that kind of a neck procedure?
Well, it's
Ideally.
at most often a week because it can bruise, but women or men can wear a high collar
Okay.
or something like that to hide things. So people can be back to work fairly quickly anyway. And here's a guy, and this just illustrates neck problems are really important to guys. People call it a waddle, type of thing. Well, look at this fellow. Neck waddles are concerned to a lot of men. They look tired and over the hill. We want to pick this guy up and really make him look great. Now, having said this, this is a good-looking neck for a guy, but not for a woman. But it makes him look a lot better, a lot more with it, a lot more competitive. The next page is of a lady, and this illustrates she's just had a neck lift. But what we wanted her to do, women want to look good with their head down, because if they're at a wedding and have a picture taken from the side, I have a friend who's a photographer, he says, a woman can pick up her chin and smile faster than my flash can reach her.
They know how to hide it then.
Yeah, but they don't want to, and they get caught, and that's the embarrassing thing with the head down.
Oh, so you made her pose like that with her head down a little bit?
Yeah, in both the pre and the post.
Okay.
And the post, you'll notice, is more head down because we want to be fair in our pictures and what we illustrate than the pre. And a lot of our pictures are that way. And the mid-face, Randy, I don't think it's addressed enough. Because what we see is, you can see in this illustration.
Is that kind of what it looks like underneath there? A little bit?
That's simplified. Because
Okay.
actually there are 5 fat pads that we have to be concerned with lifting upward. But you can see the
5?
5.
You've
yeah.
been on my show for how many years? And you've never told me there's 5 fat pads.
Yeah, there are.
Till today.
I guess so, yeah. But basically,
I was only ready to hear there was only one fat pad, right?
Yeah.
So we're talking about right here.
right here, there are a bunch of fat pads that fall downward. We call that gravitational descent.
But you could move those?
Oh yeah, yeah. And they move.
You have to move them with the muscle underneath there?
Yeah, the face is basically a mask. And the last layer is the lining of the bone. And a fellow Tessier, who's probably one of the greatest plastic surgeons of all time, described it. So what we want to do is pick up that whole mask and lift it upwards. A couple things in this woman that you notice. Basically, the distance from the eyelashes down to the bottom of where the eyelid apparently ends.
So right there, okay.
Right from here to here, the lower eyelid.
So the fat pads are dropping.
Yeah, the fat pads are dropping, and sometimes we get a little bulge of eyelid fat around there, and we call that a pot belly, the eyelid fat that pops through
Okay.
over fallen jeans, the cheek falls.
Yeah, yeah.
So what we want to do is, of course, correct the eyelid, but we want to lift that fallen jeans, that cheek pad, and you can see that when you smile, how that comes up.
Yeah.
That's why when people take their pictures, they smile so that the cheek fills out and looks more youthful.
Okay.
The way we identify people is we look first at the left side of their nose, and then our gaze goes to the mid-face. Because if you cover up the pictures from here to here, you'll see a difference that makes you, just seeing that middle face, makes people look younger, more with it.
And that's a younger woman. You did what?
I did a facelift on her, a brow lift, and a mid facelift. And she was about 50 at the time and had noticed that she aged all of a sudden.
Very nice. Now let me ask you this. Okay, so on that before, on that woman right there, on page 27, because that's subtle underneath that eye. Why not just fill in, a filler or some sort of filler under the eye?
Well, that's what's done across the country, and that's what I feel is a mistake to do that alone, because you get a little bit of the rock in the sock appearance. The rock fills out things, but you still have everything dropped in this area, and you haven't picked everything up to look natural.
Interesting.
Yeah.
Okay.
Yeah. Sometimes it works, and as I say, in the 40s, very often, that's a temporizing major. It's like a
So it could be a
Band-Aid.
nice temporary fix.
Not in this woman. She's too far along.
So with
for that.
her, you wanted to just pick that up rather than just put fat on top of it.
Right, that's true.
Could the fat on top of it even give her an odd look?
It might have, yeah. In her case, definitely.
Okay. Because that after on her, by the way, is fabulous.
Yeah, she looks really good, but it's a little bit of a lot of things rather than a lot of any one things.
Wow.
And her mother and daughter didn't notice that she had anything done. And you'll notice that in the post-op view from the side on 29, that we have her looking with her head down more than in the pre-op view, so that you can really see we've made a difference. On page 31 here, you can see the distance between the eyelashes and the bottom of the eyelid, how long that is.
So these are facelifts you're showing me right here?
These are facelifts with mid-facelifts.
So this is, because this is a young person, again, what I'm saying is, and I'm not trying to interrupt you, but when most people think of a facelift, they go, I'm too young for a facelift, because it makes you look done. But you're saying a mid-facelift is just picking up this area, which is the tired eyes.
This is a
If I have this correctly.
Yeah, this is a mid-facelift, but it's also a facelift, because there's neck changes and cheek changes and
She looks
everything along
great.
with it. Yeah, she looks much better. Again, people didn't get it, but when you see the pre and post-op pictures, you can see what was done.
Help me understand. Okay, so that woman goes into the typical medical spa, whatever. She presents with that. They're going to put fillers in there,
Right.
but
But you're not going to achieve the essence of really lifting everything. Things are still going to look down here, even though there's fillers here. The other thing is to fill that in at all, you're probably going, let's say you're using Restylane or Perlane or Juvederm or something like that, or the new one, you're going to be spending $4,000 or $5,000 for fillers to even get a decent result, whereas a cheek lift can really lift that up
and that can last for a while.
years and years and years.
So what are you lifting? You're lifting those fat pads you're talking about, the skin and the muscle?
Yeah, you're lifting the whole.
Or just underlying tissues?
You're lifting everything on top of the bone. And
Okay.
it sounds difficult, but it's very
And
simple,
where do you hide
really.
her incisions? Because you can't see them anywhere.
The incisions for the mid-facelift are right here in the temple, little ones, and a little one inside the mouth. And
In the mouth, is that right?
Yeah, and the incisions, if we do a facelift, come inside the ear and then back way up high to where this helix, or this part of the ear, meets the hair. So a woman can wear her hair up without any problem. 33, on this picture is a woman at 35 and how she looked, and a woman 54, 4 years after a facelift.
Interesting.
Yeah,
So
kinda.
did she bring her photo in from when she was younger?
Actually, we've known her for years and had photos on her.
And if I saw that woman, I mean, I think if anybody saw that woman, nobody, not even another plastic surgeon, right, could guess that she had a facelift.
Yeah, I mean, I think she looks very natural, and that's the point. Still looks like herself, but she looks great.
So you want people to
Two
look
parts
the
to it.
same, but a youthful, rested version of themselves. Is that what you want?
I want a great-looking version of themselves.
Okay.
Yeah.
Okay.
I
We-
really
and we
do.
only have a minute left.
Okay, this lady on the right is a Stevie Nicks impersonator, and basically, Stevie Nicks had a facelift, so she had to have one. But if you look here, you can see that she has these neck bands, and we've corrected those. But this middle part of the face, if you just look from the eyes down to the mouth and look at the two areas, you can see that she looks much younger just by looking at her middle face.
How old is that woman in the after?
She's in her 50s. All these women are in their 50s.
That's excellent. I mean, she looks, 42, like a youthful 42. Okay, one more.
Okay, because this is my poster child.
All right. You call your poster child what? It's like you're the most proud of, right?
Well, no, it's like the decorator that goes in and say this room really has good bones.
Okay.
It just needs to be spiffed up. Matter of fact, and this patient's sort of the same way. She has really good bones underneath, and we just have to clean everything up a little bit. I actually used that line on a decorator, and she said, I use that line all the time.
I've never heard that before.
Yeah. So you can see she has this neck sagging.
Do you get excited, by the way, at a consult because of these bones? I mean, the structure, you say, oh boy, this is going to be good.
No, I try and bring out a woman's own natural beauty.
But do you have a hunch inside, like a gut feeling, like, wow, this is going to be good?
This one turned out exceptional, I have to say.
Okay.
Yeah, and you can see how that cleans
Look at
up.
that. I mean, but see, here's the thing. I got to tell you, in the world of attractiveness, you know, she is definitely not only younger looking, but more attractive. I mean, she's doubled her attractiveness, if that's possible.
Yeah, this is a mature woman. This woman's in her 70s. She's actually 74. And
Wow.
you can see.
She looked good before, I mean, in the 70s.
Yeah, but if you look from the eyes down to the mouth, can you see how that middle part of the face really makes a difference? If you're just looking at that, you could see that, hey, this is a better looking
So that
person.
after is not touched up or anything else?
No,
Okay.
no. And matter of fact,
I mean, that's what everybody wants. I mean, if they knew, I think if people knew they could get this kind of result, they would all do it.
well, this result I don't get all the time, but everybody else is average, honestly.
Yeah. I mean, because look, you have a lot of fun. We're out of time, so they go to your website. And by the way, if you're just tuning in, we're talking about a natural-looking face with Dr. Keller. He has a brand new ebook where he very revealing, shows his work, and gives you a little bit of the philosophy of what's behind it. Is that correct? And you just flip right through it like you're reading a book.
Yeah, we want to show people why we do what we do.
They don't have to download it. I mean, it's right there on your website.
It is.
And final message, somebody, because a lot of women, and by the way, do you have people that come in, because you're on TV, do you have people that say, I've been watching you for years and I finally came in? Does that ever happen?
Absolutely, but usually it's a combination of things. They'll see me, they'll go to the website, they'll talk to some of their friends who've had things done, so forth and so on. And that's.
But a lot of people do see you on TV?
They do. Yeah.
Okay. And, so what, do you think people wait too long sometimes? Like, do they ever say, I should have done this years ago?
Oh, they say that all the time, but really, a woman is only ready, or a man's only ready to do things when he's ready. And that's the time to do it. When you're ready to do it, you're ready to do it, and that's about it. If you're not ready to do it, you're not ready to do it.
Okay, doctor, always a pleasure to have you.
Thank you very much.
And by the way, this is excellent work. Very good stuff. They go to your website, get the ebook. I'm Randy Alvarez. You're watching The Wellness Hour. I wish you good health.